Cholesterol is called silent killer because high cholesterol has no symptoms. You can have high cholesterol for years but without symptoms. Eventually, high cholesterol causes cardiovascular disease, and cardiovascular disease is #1 cause of death in United States. It also causes peripheral artery disease and pancreatitis. Now let's explain how cholesterol works. When we eat fats, our liver converts it as cholesterol, and cholesterol enters to bloodstream. Cholesterol enters to bloodstream in two forms. It's HDL and LDL. LDL is called bad cholesterol and HDL is called good cholesterol. LDL, when enters into bloodstream, it builds up plaque on blood vessels. Eventually, this plaque grows and it disrupts blood flow. When disrupts blood flow, for example, heart attacks occurs. For example, strokes occurs. So LDL is bad cholesterol, while HDL is good because it removes this cholesterol from bloodstream. That's why it is called good cholesterol. So LDL is bad, and reduction of LDL is priority. Now let's see what we have and what we know about cholesterol drugs. We have several types of cholesterol drugs which is used in case of high cholesterol, and first line treatment is statins. Statin decreases production of cholesterol in the blood, in the liver, and statin has high effectivity and high safety profile also. Second line of treatment is a bile acid sequence trans. This bile acid sequence trans binds to bile acids into intestines and inhibits their absorption. In the liver, demand on the cholesterol increases to produce new bile acids. That's why it causes reduction of LDL also. This is second line treatment. And third line treatment is PCSK9 inhibitors. And I want to mention this and focus this drug. These drugs are approved as injection forms, but injection forms have many side effects. That's why it's third line treatment. And now what is new? We have new drug which is PCSK9 inhibitor again, but it's oral form, and this oral form is called MK-0616. And what this drug is doing? This drug binds to PCSK9 receptors and inhibits them to bind LDL receptors. And why we need LDL receptors? Here we have LDL receptors on the cells of liver. These LDL receptors, this one, binds to LDL. Normally it binds to LDL, and LDL goes to cell, and it's digested. It's breakdown by lysosome. So LDL receptor is good for us because LDL receptor binds LDL and LDL is breakdown. So it's good. But it means it removes LDL from bloodstream. So LDL receptor is good. But what happens? We have this PCSK9 which binds to LDL receptor and prevents LDL to bind it. So we don't need this, and that's why we have PCSK9 inhibitors. PCSK9 inhibitors inhibits this, and LDL freely binds to LDL receptor, and it is digested and it's removed from bloodstream. And also this drug increases level of LDL receptors, and it's also good action. And these oral PCSK9 inhibitors have high effectivity, 60% reduction of LDL in 8 weeks. It's huge result. It's very good. In medicine, it's considered totally good result, and adverse effects was very few. Adverse effects was same as placebo, and it means it's very safe. But what is limitation here? Limitation is that this drug is phase 2. It means we have 3 phases, right? Actually 4 phases, but 3 is crucial. First phase is when we assess safety of the drug. People intake this drug to assess safety, tolerance, and pharmacokinetics of the drug. Second phase is when we assess drug effectivity and safety also in focus groups. The people who has disease, and this drug already passed second phase also. So on second phase it shows high effectivity and high safety. But let's wait what will be in phase 3. It's very important. After phase 3, it can be so effective if this effectivity remains same and the safety profile remains same. It can be goes to first line treatment. And now this drug PCSK9 is third line treatment. But if this oral form will show high effectivity and high safety, it really can be assessed after some time as a first line treatment. That's why it's very important. Because we see birth of new anti-cholesterol drug which will be very high effective and with high safety profile. Thank you very much. I'm Kote. If you like my channel, please subscribe. If you like my videos, please thumbs up. Thank you very much. Bye for now.